Welcome to another episode of A Week in a Life of a Surgeon. Now, is it going to be like Grey's Anatomy? Well, you need to tune in to find out. So it's start of the week and it's just gone 7 o'clock in the morning and I'm driving to work. The first activity that I have, and it happens every Monday morning, is what we call an MDT meeting. And MDT stands for Multidisciplinary Team Meeting, and it's a meeting where collectively everybody who is responsible or who are involved in looking after our patients meet together to discuss and formulate a treatment plan. So anybody who either has had a biopsy or who has had surgery or who has unfortunately been diagnosed with stage 4 or metastatic disease, they're all discussed in this meeting. It can take a few hours to complete, and people who are normally present would be surgeons, oncologists, radiologists, pathologists, the breast care nurses, and also research nurses. And so it's a pretty comprehensive meeting, and it can take a few hours. Depends really on how many patients we have to discuss. So that's the first thing I've got to do today, and in fact I'm presenting today, so I'll be presenting all the patients that we'll be discussing. So the MDT is finished, and it took about 2 hours or thereabouts, and we've discussed quite a few patients. I think there were about 50 patients on the list. And now I've got admin to do, lots of emails and just general admin work, and so that's what I'm going to do today. There was a medical student who I'm going to have to talk to and welcome to the unit and tell her exactly what goes on in the unit for the week and where we could help her in terms of what activities that she may want to be involved in. So that's what I'm going to do as well. I'm just driving to another hospital, which is about 15 minutes away, where I've got another clinic to do. It's another one-stop breast clinic where I see patients who have been referred by their GPs with a breast problem, and that's where I'm going to go now. So it's nice and sunny, it's nice, get a little bit of sunshine. You might have realized that when I left for work I was in normal clothes like this, and then when I was at work I was in blues. So what actually happened is we changed into scrubs. And this all started around the pandemic, where we would go in our normal clothes, and then we actually changed into scrubs. And then at the end of the day, obviously we had to wear PPE as well. And at the end of the day, we would get out of our scrubs and put them in a separate bag, and then get changed into our normal clothes and then go home. And this continued through the pandemic, and actually we've continued to do that since the pandemic. It's not mandatory anymore to do that. If I wanted to continue to see patients in my normal clothes, my civilian clothes, or civvies as we call them, then that's absolutely fine. And lots of people have done that, but many of us have also stuck with changing out work to scrubs and then changing back to our civvies when we go home. And so that's the reason why sometimes you see me in my civvies and sometimes you see me in my blues, and that's the reason. It's actually easier in terms of deciding what to wear, because it becomes a little bit like a uniform in a way, and you don't have to really think about it. You can go into work in your jeans if you like, you because you'll be changing into scrubs, and then you can go back home in anything you want, really. Jeans, shorts, especially in the summer. It was quite fun. You didn't have to really think about wearing, I guess, formal or very smart clothes. But at some point I'll probably go back to just wearing normal smart clothes, because there's something quite nice about wearing smart clothes. So I've just arrived in the clinic. It is a one-stop breast clinic where we see patients who, as mentioned earlier, are referred by their GPs with a breast problem. And so what will happen is they'll come to see me in this room. I will take a history, so what the problem is, their past medical history, any comorbidities, things like that. How long have they had the symptoms for? Then I'll examine them, and then I will send them round the corner to the radiology department to have some scans, either a mammogram or an ultrasound scan, or both. And if they have a biopsy, then they will have it done there and then. And they'll come back to see me afterwards, and we'll have a discussion about the results. Thankfully, the majority of people who come to see me are fine, and hopefully they can be reassured after my examination and their scans that everything is okay. But unfortunately, sometimes we do pick up cancers, and if they do have a biopsy, then I will see them in a week's time when the results of the biopsy becomes available. The important thing to note, though, is just because you have a biopsy does not necessarily mean you have a cancer, because sometimes you would do a biopsy on things that may not be a cancer, but we may not be sure what it is, and we really need to know what we're dealing with, and that's why we would do a biopsy. So just because you have a biopsy does not necessarily mean you have a cancer. Nevertheless, we'll see them in a week's time with the results. The other thing to note is there will be a breast care nurse present with me. I'm a bit early, so she'll be coming in very shortly, and she'll be present with me throughout the clinic. She chaperones me, so to make sure that there is somebody else in the clinic whilst I examine the patients, and if I have to break bad news, then she is also around. So she is with me throughout the duration of the clinic, and that's an important point to make, because breast care nurses are invaluable. They are the point of contact for patients who, if they do have cancer, then they will be their point of contact. They advocate for them, and they make sure that any problems, any issues, any concerns that the patient will need to talk about, they will always talk to the breast care nurses, and then they can come and see me and ask me any questions. But the breast care nurses are vital in the process of breast cancer treatment. Unfortunately, I forgot my water bottle, so I had to buy some bottled water, which I'm really trying not to do because it's plastic, and I always try to refill my water bottle, but unfortunately I somehow forgot to bring it with me in the rush this morning. But yeah, it's so important to stay hydrated, guys. It's so important. So that's the end of the clinic. It's just about 8 o'clock, and I'm wrapping up here, and then I'm going to drive home and ready to get something to eat, bite to eat, dinner, and I'll see you tomorrow, bright and early. So today's Tuesday and it's clinic day. I've just had lunch, and basically we have clinics back to back in the morning and in the afternoon, and I'm towards the end of the afternoon clinic. You might be wondering, what do I do in clinics, and what kind of patients or type of patients do I see in clinics? And it varies. So there is a one-stop breast clinic where we see new patients. This clinic is a results clinic and a post-op clinic. So in this clinic, I would be seeing patients I've operated on and giving them results of that surgery. And based on that results, then we can decide what else or what other treatment we need to do, such as potentially chemotherapy or radiotherapy, as well as tablet treatment. I also do post-op wound checks as well, make sure they're all fine. The other kind of patients that we see would be patients who we are planning surgery for. So we would have had the results of the surgery, they might have gone away to get more tests, such as an MRI scan or CT scan, and then they'll come back to see me and we can talk about what type of treatment would be best suited for them next. So that may be surgery, and then we'll then talk about the type of surgery that they may need, or they may also need chemotherapy first, for example, and that sometimes happens as well. And unfortunately, during these clinics, I also have to break bad news. And these are the times when patients would have had a biopsy of something abnormal, and they come back today for me to tell them that unfortunately they have cancer. And it can be quite tough, obviously, because it's something they do not want to hear, and it's something that us as doctors don't particularly like doing, but unfortunately we have to do it as part of our job. And as a cancer doctor, I do this, unfortunately, all the time. So, so those are the kind of patients that I have seen today, and I'm just wrapping up now, and hopefully heading home at some point soon. So, middle of the week, it's Thursday day today, and it's a bit of a grey day. It's been raining most of the night, I think. And it's a busy day. I think I have about 4 patients to operate on today, and one of them is a joint case with my colleague, because it's a bilateral case, meaning that both of the breasts will need to be operated on this same patient. And whenever there is a bilateral case, we always try to do it jointly with 2 surgeons. And the reason for that is we want to make sure that the anaesthetic time is halved, because if there's only 1 surgeon, then it'll take double the time. Or in other words, if you have 2 surgeons, it should take half the time. And that's it's better for the patients as well. So that will be probably the last case of the day will be done together with my colleague, which will be quite great, which will be quite nice. So yeah, always when I'm driving, I do try to not be distracted and give myself some me time in a way. So I don't, at times I don't have the radio on. I normally, either listen to the radio or podcast. But on some mornings, I actually don't listen to anything, and just have some headspace time, some time to think about the day, some time to gather my thoughts, and just be present in the moment. So it is Thursday, and I'm really sorry, but yesterday, operating day, became so busy, and I didn't really have a chance to show you anything much at all. So I'm sorry about that. Just one of those things that can happen, and when the day goes just crazy, then it just passes you by, and before you know it, it was the end of the day. Today's a new day, and it's lunchtime. I've just done a morning clinic. It's double clinic day today, and it's a double one-stop clinic. So in these clinics, I see patients who've been referred by their GPs with a problem with their breasts. The majority of the time, they are fine, thankfully. Sometimes, though, we do find cancers, and they will have biopsies if this is the case. Sometimes people will have biopsies and it may not be a cancer. So just because you have a biopsy does not mean that it's a cancer. We just need to know what we're dealing with, even if even if it doesn't look worrying. So I've had the morning clinic. I'm just about to get some lunch, and in the afternoon is another clinic. So I think at the end of the clinic, at the end of the day rather, I probably would have seen about 30 patients of varying ages. So that's what today is all about. Tomorrow I am operating, so I will promise I will show you a little bit more of operating stuff and behind the scenes stuff. Okay, so I'm going to get some lunch now. Did opt out for the slightly healthier option today. Let's see what I've got. I've got some salad, some protein, some dessert. Forgot my fork. I'm in the One Stop Breast Clinic now, and we are about to do a biopsy. This is the biopsy tray. There's a needle, syringe, local anesthetic, antiseptic wipe, and those are the biopsy needles that we're going to use. And the abnormality was actually found on a mammogram machine, and this is what it looks like. We also found the abnormality on the ultrasound scan in the One Stop clinic room, and that's where we did the biopsy. So that's the end of the clinic, end of the day. It was quite busy. We had to do quite a few biopsies today. We won't get the results of those for another week or so, and so these patients will be called or either seen face to face for us to give them those results. It can be a little bit, an anxious time because they have to wait this length, but it does take a while for the pathology lab to process whatever it is that we take, the biopsy sample that we take, and they need the time to process it and analyze it. So I do feel for the patients who have to wait, but unfortunately that's just how long it does take. So I'm just going to wrap up here for a while, and then it'll be homeward bound. So I'll catch up with you tomorrow. So I've just finished an MDT meeting, which is a multidisciplinary team meeting virtually. And during this meeting, we collectively discuss all patients who've come or gone through the breast unit. So just finished that just now. So I'm just going to have another cup of coffee before the start of my One Stop Breast Clinic. So yeah, it's a full-on day today. So I finished my clinic in the morning, had a quick lunch, and now I am about to start my afternoon operating list. There's a bit of a delay in starting the list, which sometimes happens. So I've taken this opportunity to talk about what is on the list. There are a few cases on the list. First patient is having a mastectomy. She's had, unfortunately, been diagnosed with cancer in 2 different areas in the breast, and as a result we can't really conserve the breast, we can't do a lumpectomy, so she's having a mastectomy, which is the removal of the whole of the breast. She also has some positive glands in her armpit when she was diagnosed, which means that we have to take all of the glands from the armpit at the same time. She's decided not to have reconstruction, so I'm just doing what we call a simple mastectomy and an axillary nodal clearance, and when she wakes up she'll be flat chested. The second patient is having a lumpectomy. She has a small cancer, which means that we can just remove the lump, the cancer, and keep the rest of the breast as it is, so the rest of the breast is intact, can be kept intact. And I'll remove a few of the glands from the armpit with a small incision with a procedure called a sentinel lymph node biopsy. And that's because when she came, she didn't have any abnormal glands in her armpit. So hopefully that will be clear. So instead of like the first patient where I'm going to remove all of the glands, in the second case I'm just going to remove a few, and we will test that as well. And if they are clear, then that's great. She won't need any more further surgery to her armpit. So that's what I'm planning to do this afternoon. Hopefully the delay won't be too long now, and we'll be able to start very soon. A break between cases and a hot chocolate to keep me going. So hi everybody, it's the end of the day. I've just finished operating, just seen my patients did a round, and it's just past 10 o'clock in the evening. Yep, we started late, the delays were slightly prolonged, and so we started late, so we finished late. And this is just an example of what being a surgeon is like. Sometimes things happen and they are unexpected, and as a result, you know, the day that should have probably finished at 5:36 turned out to be a longer day than expected. And so, you know, sometimes you might have planned an evening out, or, you know, going to the cinema, meet friends, family, whatever, and then something happens like this, and then lo and behold, you can't do that and you can't make it. So that is what being a doctor and being a surgeon can be like, or is like actually. Anyway, hope you've enjoyed this video, and I will make another one of these very, very soon. And do comment in the section below, let me know what your thoughts are. Okay, take care.